Alright guys, what I'm going to talk through in this video is hip hinge movements. Hip hinge movement, really, if you're thinking of an exercise that includes, is the likes of your deadlifts, RDLs, rack pulls, which I'm going to demonstrate briefly here as well because it's a very easy movement to do, kettlebell swings, so anything that really involves your hips hinging. So it's sort of this sort of movement where the only joint that's really moving is of your hip and then maybe a slight bit of movement in your knee. Now, a lot of people tend to do these wrong and they really can't understand them. So if they're doing like an RDL, what they'll tend to do is their knees will come forward and they'll kind of come down like this into some sort of squat. Now, what you're looking for most of the time when you're doing a hip hinge movement is maximal tension on your posterior chain. So that's your back, your erectors, down your back, your glutes, and your hamstrings. All right. And how do we get tension on your glutes, hamstrings, and back? Okay. Now, it's not through knee flexion. It's through hip extension and hip flexion. So it's always working through the hips. So we're going to use a rack pull as an example for this and an RDL. I'm using a very light weight here just to show you how to do the movement. So when people are stepping into a rack pull, what's the first thing they usually do? Is usually you see this sort of bending of the back, this flexion of the spine. You don't want this. You want to brace yourself. So if you remember when we covered in the squat video, you know, we kept everything braced, everything locked into place. So remember, look, we talked about feet first. So feet, keep them pointing straight ahead. Plant them into the ground. Grab onto the bar. Now, when you're doing these, you want to keep the bar around just above your knee height. Is really a comfortable place to do this from. Again, you don't want your head up. You want your head down, fixed into place, and you want to lift with your hips. You don't want to lift with your back. All right. So if you notice what we covered in the squat video, I'm saying a lot of the same things here. All right. This is all repetitive. You're doing the same thing over and over, just with slightly different movement patterns. Okay, so feet first, feet pointed forward, knees soft, not completely bent, but just soft. All right. Now from here, we're not going to bend our back down to lift. We're going to keep our back straight. You're going to retract your shoulders, pull them back, and then depress them, drive them down. So you're kind of standing up nice and tall. And then from here, I want you to take your hands, rub them down your thigh, keep your knees soft, and you should feel that stretch in your hamstrings. All right. Now, if you look at me, I'm kind of like a wedge, you know, I'm kind of like a boomerang shape. That's what you want. You're going to grab the bar, and from here, I don't want you to imagine lifting the bar, all right? What I want you to imagine is driving your feet through the floor, all right? Now, if you do that, if you imagine driving your feet through the floor and corkscrewing them through the floor, you're going to lift with your glutes rather than just lifting slowly with your back. If you're lifting, you know, if you're trying to lift with your back, trying to not imagine pushing through the floor. Okay, so from here, feet are planted, squeezed into the ground, glutes are tensed, heads down, shoulders are retracted and depressed, and then from here, I'm just going to drive my hips forward and squeeze my glutes rather than trying to lift the bar up. You're doing the same movement, it's just how you're doing it. So how you're doing it matters a lot more than what you're doing in terms of the movement. So I'm still doing a rack pull. So if I'm doing a rack pull, I'm looking to lift the bar, that's a lot more back focused. If I'm doing a rack pull, drive my hips forward, it's a lot more glute focused. You can't see it with the naked eye, but you can feel it when you're doing the movement. So always keep in mind to use your glutes. They're big for a reason. They hold you upright. So make sure that you're really contracting those glutes and you're driving your hip forward as you lift, and you're not just trying to lift the bar up. If you apply that to every other hip hinge movement, okay? So let's just pull this bar out. Let's take an RDL for an example. Same idea, except you're going a bit further down, all right? So I'm just going to drive my hips back, rub the bar down my thigh. Shoulders are retracted, heads down. I'm going to go to about there. Any further, my back starts to flex. No tension on the hams or glutes. We don't want that. And I'm driving up. I'm driving my hips forward. And watch, the only joint that's moving, hips. So you should feel that stretch in the hamstrings. And that is how I want you to hip hinge. Okay? So a really, really simple thing you can do, you can imagine there is a pole going through your head, straight down, out your hips and into the floor. and it's staying straight. All right, so hips upward, nothing is moving. Hip joints moving, knees aren't moving, so you're doing this movement. You're trying to get that stretch in the hamstrings. This takes a lot of practice. This is usually the movement that clients I will see struggle with the most. Over the years coaching, this is what I find clients struggle with the most. Usually in terms of they have poor posture, internal rotation, rear delts aren't very strong, and their front delts packs are quite tight, so they find it hard to not round their back. Weak glutes, weak hamstrings, but over time, practice makes perfect. So repetition is the key here. So make sure that before you start really packing on the weight, you get the movement right. It's not what you're lifting, it's how you're lifting it. So always keep that in mind.